Welcome to this explainer. I want you to close your eyes for just a second and picture a modern operating room. You know the scene, right? The bright, intense lights, the gleaming steel instruments, that perfectly sterile environment, and those incredibly precise, life-saving techniques. Okay, now I want you to rewind the clock a full 1,000 years. We're embarking on an epic, cinematic journey right back to the medieval world, because we are going to uncover the mastermind who single-handedly designed the future of that modern operating room. It's honestly a genuine historical mystery. How did a surgeon living more than a millennium ago, in an era we usually associate with visceral, highly dangerous, and, let's face it, pretty rudimentary medieval medicine, how did he create surgical tools that look practically identical to the sterile, advanced instruments used by your doctor today? How exactly did one person manage to transform what was a really dangerous craft into a rigorous scientific discipline? Okay, let's dive into this. The answer to that incredible mystery is a mostly forgotten pioneer named Abu al-Qasim al-Zahrawi. Known over in the Latin West as Al-Bukhasis, he was this extraordinary Andalusian physician who didn't just practice surgery. He quite literally elevated it out of the Dark Ages and turned it into a true empirical science. Think of our agenda today not just as some standard list, but almost like the opening pages of an ancient, leather-bound manuscript that details a genius's legacy. We're going to explore the Golden Age of Córdoba, open his medical masterpiece Al-Tasrif, uncover his revolutionary surgical tools and procedures, and finally trace his eternal medical legacy. All right, let's set the scene with Section 1, the Golden Age of Córdoba in 10th century Al-Andalus. To really grasp Al-Zahrawi's genius, you've got to understand the world he was living in. While a lot of the broader medieval world was still relying on super rudimentary, sometimes even superstitious medicine, 10th century Córdoba was this flourishing, absolutely stunning jewel of the Islamic Golden Age. It was a sprawling, advanced metropolis packed with massive libraries experiencing a totally multicultural intellectual explosion. And they had these advanced hospitals known as Bemarstans, which actually provided highly systematic healthcare. It was right here, in this vibrant, dynamic environment, that Al-Zahrawi thrived, eventually rising all the way to the elite position of royal court physician to Caliph al-Hakam II. But here's the thing about Al-Zahrawi. Despite having this super elite status at the royal court, he was a fierce advocate for social justice. He insisted on treating all patients, totally regardless of their financial or social status. He even affectionately referred to his medical students as "my children." And this profound egalitarianism, it wasn't just morally way ahead of its time, it was scientifically invaluable. By treating thousands of everyday citizens on a daily basis, he gained this immense, unparalleled clinical exposure, and that allowed him to systematically observe and carefully record a massive diversity of human pathologies. Which brings us to his absolute magnum opus, Section 2, Al-Tasrif, the medical masterpiece, representing 50 years of clinical observation. 30. Just take a second to process that number. That is the staggering number of volumes in Kitab al-Tasrif. This wasn't just a book, guys. It was a legendary, massive medical encyclopedia that took over half a century of relentless clinical practice, anatomical dissection, and pure trial and error to finally complete. It was designed to cover absolutely everything known to medical science at that time. Now, what's really interesting about this slide is how his masterpiece was actually structured. It was incredibly comprehensive, covering general medicine, therapeutics, pharmacology, and even cosmetics. But check out that final volume. Volume 30 is entirely dedicated to surgery, and he intentionally placed it last. Why? Because he firmly believed that surgery was the absolute highest, most complex form of medicine. He thought a physician had absolutely no business picking up a scalpel until they had fully mastered every single other medical discipline first. His core philosophy was totally uncompromising. He wrote, "He who devoted himself to surgery must be versed in the science of anatomy." He was actually really frustrated that surgery in his time had decayed into this highly dangerous trade performed by largely unqualified people. His absolute conviction was that an intimate, incredibly rigorous knowledge of human anatomy was the non-negotiable prerequisite before a surgeon could ever dare to make a single incision. So, let's open up that legendary final volume. Section 3, Inventing Modern Surgical Tools, and essentially designing the future of medicine. Volume 30 is, without exaggeration, a monumental landmark in human history because it is the very first illustrated surgical text ever created. It contains over 200 original surgical instrument designs. We are talking precision scalpels, obstetrical forceps to safely assist in childbirth, bone saws, retractors to carefully hold back tissue, vaginal speculums, lithotomes for crushing bladder stones, cautery knives, surgical hooks, syringes, and suturing needles. And he didn't just casually sketch these out. He completely standardized their designs. He specified exactly when to use tempered steel, silver, or bone to ensure supreme safety, durability, and surgical precision. And sometimes pure genius strikes in the most unexpected, almost funny ways. It actually started when Al-Zahrawi's pet monkey accidentally ate the strings of his oud, which is a musical instrument, kind of like a lute, and it was strung with animal intestines. Well, he watched the monkey closely and observed that the animal suffered zero ill effects because its body naturally dissolved and digested the catgut strings. Boom. The realization hit him. This material could be used safely right inside the human body. He literally invented absorbable catgut sutures for internal surgeries, a material that dissolves completely naturally without ever needing to be removed, which ended up preventing countless lethal infections. But his brilliance wasn't just about the physical tools. Al-Zahrawi also pioneered surgical asepsis. Literally hundreds of years before we discovered germ theory or even knew what microorganisms were, he absolutely insisted on using wine and alcohol to thoroughly clean and sterilize his tools as well as his patients' wounds. He knew empirically, just through rigorous observation, that this extreme cleanliness drastically reduced lethal infections and massive pus formations. He was massively improving patient survival rates long before anyone else understood exactly why it worked. So, let's look at how he actually applied these tools in the operating room. Section 4, revolutionizing medical procedures, taking it from a dangerous craft straight into a scientific discipline. And this brilliantly illustrates exactly how his clinical breakthroughs spanned across the entire human body. In ear, nose, and throat medicine, he proved that a severed larynx could actually be safely sutured back together, which laid the crucial empirical foundation for modern tracheotomies. Over in neurosurgery, he detailed the precise evacuation of intracranial fluid to treat hydrocephalus in infants. In urology, instead of doing these super painful, highly lethal extractions, he invented a specialized drill called the Mitch-Ab to safely crush bladder stones right inside the body before removing them. He was literally saving lives in critical, terrifying situations that other physicians of his time thought were entirely impossible to fix. And his astonishing versatility extended way beyond the operating table. He was actually the very first physician in history to accurately describe hemophilia as a hereditary bleeding disorder. He gave the absolute first detailed account of an ectopic pregnancy. He performed the earliest officially documented thyroidectomy. He even dove deep into pharmacology and cosmetics, devising some of the earliest solid deodorant sticks and lipsticks. And to manage the sheer pain during his intense surgeries, he utilized soporific sponges soaked in narcotics like opium and hemlock to induce a deep, sleep-like state. It was a remarkably effective early form of anesthesia. So how exactly did this Andalusian genius shape the world we're living in today? Let's move to our final chapter, Section 5, An Eternal Medical Legacy, Bridging a Millennium. Let's move to and see how this builds across continents and centuries. In the year 1000 CE, Al-Tasarruf is officially completed in Córdoba. By the 1100s, it's translated into Latin by Gerard of Cremona, absolutely revolutionizing European medical thought in the process. Jump to 1363, and the famous French surgeon Guy de Chauliac ends up citing Al-Zahrawi over 200 times in his own masterwork. Al-Tasarruf remains the absolute standard surgical text in European medical universities well into the 1700s. And today, over 1,000 years later, the foundational principles of his instrument designs and his aseptic techniques are quite literally still utilized in modern operating rooms. Bringing the story right into the present day, the father of modern surgery is finally getting the global recognition he deserves for his monumental contributions. If you happen to visit modern Córdoba today, you can actually walk down Calle Albucasis, a beautiful street officially named in his honor, where his original home at number 6 is preserved by the Spanish Tourist Board. And museums everywhere from Madrid all the way to the Middle East, exact, stunning reproductions of his magnificent 200 surgical instruments are proudly displayed. It really makes you stop and reflect on the nature of human progress. Great discoveries are not limited by time. They are created by minds willing to observe, to question, and to innovate.
Al-Zahrawi's transcendent genius wasn't magic, right? It was his relentless empirical method, his deep, unwavering compassion for all his patients, and his absolute, unyielding desire to solve the most complex puzzles of the human body.
So I'm going to leave you with this final provocative thought to ponder. The next time you or maybe a loved one are sitting in a hospital, take a second to look around. Look at the retractors, the forceps, the dissolvable stitches, that perfectly sterile environment. What modern miracle are we totally taking for granted today that was actually perfected a millennium ago by Abu al-Qasim al-Zahrawi? It is incredibly humbling to think about. Thank you so much for joining me on this explainer, and always keep questioning the amazing history hidden behind the world around you.